You're seeing the ads everywhere. Testosterone replacement therapy, delivered to your door. But how does it actually work in Australia? Before the details, know this critical fact. TRT is often a lifelong treatment. Stopping it can shut down your body's own production for good. The primary draw is undeniable. A streamlined, convenient process that promises to be faster than traditional GP visits. But this convenience comes at a significant private cost, often running into thousands of dollars per year. We will now break down the entire online TRT process, from the first click to the ongoing treatment, including the costs, the risks, and what you must know. First, let's be clear. TRT is not an over-the-counter supplement. It is a highly regulated Schedule IV medication requiring a valid prescription. Your path doesn't start with a consultation. It starts with a blood test. Clinics require a full blood panel before they will even speak to you. To qualify, you need to meet two key criteria. First, you must have legitimate symptoms. Second, your blood work must show clinically low testosterone levels. The central pillar of this entire process is the telehealth consultation, connecting you with an Australian-registered doctor via video call. A good doctor won't just look at your testosterone levels. They must rule out other potential causes for your symptoms, like depression or sleep disorders. So, you have the symptoms and you've done the blood work. What happens next? This is where cost and accessibility become a major factor. Why is online TRT almost always a private expense? It's because of the strict criteria for the Pharmaceutical Benefits Scheme, or PBS. To get subsidized testosterone, your low levels can't just be from aging. They must be due to an established medical cause, like a pituitary gland issue. Since most will be paying privately, what is the actual, all-inclusive annual cost you can expect? We'll break down the numbers in a moment. The entire diagnosis hinges on blood work. It measures your total testosterone, free testosterone, SHBG, and other vital markers. But a single test is just a snapshot. Testosterone levels fluctuate. Proper diagnosis often requires multiple tests to confirm a consistent deficiency. This isn't a one-time fix. Treatment requires regular follow-up blood tests, typically after 8 weeks, then every 4 to 6 months to monitor for side effects. So, you've had your telehealth consult and you've been approved. The doctor will issue an e-script sent directly to your phone. You'll then get your medication, which is typically in the form of topical gels, patches, or injections, with injections often preferred for stable levels. Now for the cost we asked about earlier. All in, you should budget for between $1,650 and $2,300 per year for consultations, blood tests, and medication. This cycle of consultation, prescription, and monitoring repeats. It's a continuous relationship with the clinic to manage your dosage and health. The process is designed for convenience, but this can mask significant risks. What are the major red flags you need to watch out for? A major red flag is the marketing of suboptimal or low normal testosterone. Some clinics may treat levels that are technically in the normal range. A critical limitation of the online model is the lack of a physical examination. A proper in-person assessment is vital for a thorough diagnosis. The treatment itself carries significant risks. These can include reduced or permanent infertility and increased red blood cell production. This thickening of the blood raises the risk of clots, stroke, and heart attack. Other side effects include acne, sleep apnea, and gynecomastia. The biggest danger is when TRT is prescribed for symptoms caused by something else. If the root cause is poor sleep, it is a harmful misdiagnosis. Let's connect the dots. Recall the marketing of suboptimal levels? This tactic preys on men who may have had only a single, insufficient blood test. The streamlined convenience promised by online clinics can sometimes come at the expense of diagnostic rigor. This lack of rigor No physical exam, maybe only one blood test, overlooking other causes, directly increases the risk of misdiagnosis. When you combine this risk with the lifelong commitment and the $2,000 annual cost, the stakes of getting it wrong are incredibly high. Online TRT in Australia offers a convenient path for men with a legitimate medical need. But this path is surrounded by significant financial commitments and risks. Remember the key points. It is a lifelong commitment. A solid diagnosis is non-negotiable and requires more than one blood test. The goal is not to scare you, but to arm you with the right questions to ask. You are the CEO of your own health. Be thorough and advocate for yourself. If this guide was helpful, share it with someone who might need it. What has your experience been? Let us know in the comments below.